And now we hand over the remaining time to Dr. Chua.
Thank you, James, for the very kind introduction. I am a practicing trauma surgeon. My other interests will be doing arthritis, robotic joint replacements, bone health, osteoporosis. So today I'm going to talk to you about bone health, osteoporosis. It is a silent risk. We working class, we go to work when the sun is not up and we go home when the sun is not visible anymore. So this is a real problem for us. We often think about cardiovascular health, but we don't think so much about bone health or muscle health. All right, I have a few infographic slides. I'll tell you the most impactful statistics. 1 in 13 men will have osteoporosis in your lifetime. And for women, 1 in 5. 1 in 5, huh? And 1 in 3 women will get a frigidity fracture, an osteoporotic fracture. And 1 in 5 men will also similarly suffer an osteoporotic fracture. Hip fractures are the most well-known of all osteoporotic fractures. And the incidence just doubles every 50 years. What's so important about hip fractures? 75% of hip fractures occur in women, and that means 25% in men. They cause significant disability, chronic pain, and immobility. And the risk is actually comparable to the risk of stroke. What happens after a hip fracture? Many of them can't walk independently. 1 year, 40%. Some statistics say it's 50%. And hip fractures cause the most morbidity. Imagine after a patient suffers a hip fracture, up to 20 to 25% will not be around with you after the first year. How about vertebral fractures? Only 1/3 of all vertebral fractures are clinically important, meaning we only detect 1/3 of them because they cause pain. That means the 2/3 of them are silent, and they have the same age-adjusted mortality compared to hip fractures actually. How about men? Men have greater risk of frigidity fracture than prostate cancer, being prostate cancer one of the top killers for us, men. And the mortality in men is actually higher than that in women. It's something that is surprising. There is a 300% increase of hip fractures in the next 20 years. The incidence of osteoporosis in Singapore is actually estimated about 400 in 100,000 people. That puts us in the aging part of the world as a developed country. Look at the charts. At the top is Denmark, Sweden. They have the oldest population, and Singapore is not very far away. These two graphs just shows you that we get vertebral fractures first, as shown in the light blue line. In the early ages, we get vertebral fractures first, and in the later ages, we get wrist and hip fractures. They affect later on. So if you do have a silent vertebral fracture or even a wrist fracture later on in the 50s, if we don't diagnose and treat osteoporosis, it may become a hip fracture later on. This is the osteoporosis self-assessment tool for Asians, and it's only validated in women, not for men. So you can see on the box, this chart, you can plot your height, your weight, as well as your age, and then you can roughly tell, are you in the high risk group, medium risk group, or low risk group. And on the right side, there is a chart of all the known risk factors. For example, family history, a previous frigidity fracture, aging, low body weight. Many of us don't like to be obese. Height loss, more than 2 centimeters within 3 years. Early menopause, 45 years and younger. Low calcium intake, excessive alcohol, smoking, immobility, for example, sitting in a chair for too long. History of falls and certain medications and diseases that affect the bone itself. When should I get a bone density scan? The OSTA, the osteoporosis self-assessment tool, once you look you're in a high-risk group, you should consider getting a bone mineral density scan. If you're at a medium risk with one of the risk factors in the chart, you should consider getting a bone density scan. If you're neither of them and you're just going by age, according to current recommendations, if you are a woman above the age of 65, man above the age of 70 with no risk factors can consider getting a bone mineral density scan. And those with risk factors and younger, please do see someone, a GP, someone to get a bone density scan. So what is a bone mineral density scan? Basically, you are shuttled into this room and then you lie down on the couch, your hips are flexed just to obtain a reliable position for the hip. And the machine will take an X-ray over the next 1 to 2 minutes of the hip as well as the lumbar spine. And we end up with those two charts. And we get a T-score or Z-score which the doctor will interpret for you. We interpret the T-score if you're above the age of 60 and the Z-score if we are much younger. So what is the difference actually? The T-score basically compares your bone density to that of a healthy 30-year-old. And the Z-score compares your bone density to an age, race, sex match database of the bone density. So the Z-score is low, your bone density is poorer than others of your same age and sex. So the other thing we use about data from the bone mineral density scan is that we input into this complex table called a fracture risk assessment tool. This tool has been in use for more than a decade and is so useful for practitioners like us who would estimate the fracture risk for you. So we input the age, your date of birth, sex, height, weight, and certain risk factors in there, and then the femoral neck bone density in there. And then we come out with a set of figures and estimation. This assessment tool utilizes a population-based database to come up with this figure. So we have Singapore in the Chinese, Malay, Indians, and Caucasian database. And every population gives a slightly different fracture risk. So if let's say we come out with this risk estimation, 30% major osteoporotic fractures. And what does it actually mean? It basically means in 10 years, 1 out of 3 falls that you might experience, you might get a major osteoporotic fractures. I pause here for a couple of seconds. You can scan this. This is on the International Osteoporosis Foundation website. You go through a checklist and they can actually tell you, email to you your risk factors and your osteoporosis risk. So when should I see someone for bone health assessment? So if you have a fracture, you have previous fractures before, you are of the right age group, more than 65 in females, more than 75 in males, go see a GP or in the private clinics or polyclinics. They can further assess and let you know whether you need to do a bone mineral density scan. Or if you have 1 fracture or 2 and you are truly concerned, you can see a specialist like myself. What is a fragility fracture? A fracture that results from minimal injury is a fragility fracture. For example, you trip and you fall down, or you step into you have ankles, you sprain your ankle and you fall down. Yeah, so that causes a fracture. So examples of fractures are like this: proximal humerus, the shoulder, the elbow, the wrist, the hips, both two common types of hip fractures, the knee, ankle, spine. This is a typical vertebral compression fracture. Pelvis. So let's talk about preventive strategies. If you're one of these, you are at risk. Alcohol, smoking, low bone mass index. Right? 4 things that you need to think of for your bone health. Vitamin D, take calcium-rich food, protein-rich food, and lead an active lifestyle. Eat well, take more calcium, take more protein, and take more vitamin D. You can look at this table. There's too many things up there. How much calcium do we actually need? Actually, For us, most are working class, we need about 800 to 1,000 milligrams of calcium every day. Once you are above the age of 60, 70, you need 1,200 to 1,400 milligrams of calcium every day. Because different guidelines may have a slight variability, but it's about the same. And if you truly analyze how much of your diet contains calcium, you will find that your diet do not contain sufficient calcium. How about vitamin D? Vitamin D is important for muscle and bone. Vitamin D helps in calcium absorption from the intestine, helps the bone to uptake calcium. It also helps the muscle to function properly. And amongst that, it also helps your skin and your hair to be more healthy. If you consult a dermatologist, they will tell you, take more vitamin D. How much vitamin D do we actually need? In our working class, we need about 600 to 800 milligrams international units of vitamin D every day. I can tell you this is grossly not enough. How much sunlight do you think you need every day to have sufficient vitamin D on a daily basis? 30 minutes of good UVB. 30 minutes. We don't even get 5 minutes of sunlight every day. If you take this cumulatively, we work Monday to Saturday, or sometimes Monday to Friday, you will be vitamin D deficient. In fact, in our part of the world, in the sunny part of like sunny Singapore, the incidence of vitamin D deficiency is as high as 70%. This has been well published. So think of vitamin D more than calcium actually. How about protein? We all are very crazy about protein nowadays. For example, in healthy adults, we need 30 grams of protein every day. Think about your diet. Do you actually take 30 grams of protein every day? I doubt so. One egg, a 50-gram egg, how much protein? 6 grams of protein. In order to get your 30 grams of protein every day, you need to eat 5 eggs. That's kind of unrealistic. 5 eggs every day. Lifestyle, active lifestyle. I can never stress this more. The only way to stimulate bone is to work the bone and the muscles around the bone. Move. Even in your office, move. Don't keep sitting down. Of course, work ties you up for 1 or 2 hours, but please take breaks. Do something. Do something, for example, walk around the office, move up and down the steps or something like that. Just take the stairs instead of the lift. When you head out for lunch, walk outside. Go outside purposely to get some sunlight. Of course, women are a bit afraid of getting sunlight because of all the skin problems, but it is essential. Every little bit counts in the working day. Let's say we go back. So we often need to think about how to maintain our muscle health and bone health. Think about exercises. What kind of exercises do we actually need? For cardiovascular health, we need aerobic exercises. We run, brisk walk, cycle, just to get the heart to pump harder for a sustained period of time. We also need weight-bearing exercises. So weights are good, excessive weights are not. The third thing is resistance exercises like swimming and some of the aerobic exercises also incorporate some resistance inside, for example, Pilates. So these 3 types of exercises are very important for maintaining bone and muscle health. What are our treatment options? Basically, once you have diagnosed to be osteoporotic by your GP or by your specialist, we will talk to you about treatment options and why do we need to treat. Let's look at this set of figures again. 30% risk of major osteoporotic fracture and 15% risk of hip fracture. For us, in our local population, we accept hip fracture risk to be 3% and below. That is very low. 3% of hip fracture in 10 years. So our target of treatment is to lower this risk to an acceptable level for your age group. Broadly speaking, osteoporosis treatment options, they can be divided into oral and injectables. Most of the drugs in the market now, they stop bone from disappearing. Our bone is constantly in a flux, being cleared and being laid. This is the bone turnover cycle. Most of the drugs stop bone from clearing away. There is 1 or 2 drugs that build bone, specially stimulate bone, and these are very efficacious in increasing the bone density. So first up, we have bisphosphonates. We have oral form, which is taken once weekly, Fosamax and Ectonel, and the injectable once every year. Oral bisphosphonates are usually taken for 3 years if it's injectable, or the oral for 5 years. But they have a limited efficacy. Side effects, lots of stomach side effects, reflux, etc. This is very popular, denosumab, or we term it as Prolia. The generic is in the market already. Very convenient to administer, two times a year. Basically, it stops bone from disappearing, and it has a very good net effect of building bone, year on year, 10, 15 years. Side effects, very rare actually. Less than 1% risk, you have muscle ache and joint pain. Rash is extremely uncommon. And once you have gastric side effects, this is the next drug most of the doctors in Singapore would recommend, denosumab. Next up, teriparatide. Not so preferred because this is a daily injection, just much like insulin. And once you start that treatment, it goes on for 18 to 24 months. Very good drug, builds bone very fast and maintains it. There are some side effects, giddiness, high blood calcium, rash. Last up, romosozumab or Evenity. This is what we like as a wonder drug. It builds bone so fast that is equivalent to 5 to 7 years of taking Prolia, which is the once every 6-month drug. It basically builds bone and also stops bone from disappearing. And the side effects are very, very, very rare. But this is the most expensive drug in the market. So of all these drugs I've mentioned, only bisphosphonates and Prolia are currently subsidized by the government. The rest are not. The risk of osteoporosis treatment, I will just go through very, very briefly. Atypical femoral fracture, which is another type of thigh bone fracture. Usually it often thought of as a stress fracture. No minimal injury, the bone just breaks. Sounds scary, right? But the risk is actually very low. Meaning, why? We are trying to prevent you from having osteoporotic fracture, which is much, much higher risk. And this risk in Asians is actually very low, 1 in 2,000. Osteonecrosis of the jaw, where the jawbone just disappears and melts away. Well, usually this, because poor dental hygiene, there is ongoing bone decay that may trigger a vicious cycle of causing the bone to melt away. The risk is even lower, 1 in 5,000 to 1 in 10,000 actually. Muscle ache, joint pain, low blood calcium, these are actually quite rare. Your doctor should monitor for these very closely and at appropriate intervals once you're on treatment actually. So last, think about your bone health, muscle health. If you're at risk, you must see someone. See a GP, see a specialist for bone health assessment. And you must stay active. Thank you.